Good day, Miss Arnold. Me and my group members, Rihanna, Carlos, Maurice, Amber, and myself will be presenting on maternal stress during pregnancy and its effects on fetal brain development.
When we think about pregnancy, we usually focus on physical growth, but brain development is just as important. Today, I'll be talking about how maternal stress during pregnancy can affect fetal brain development. Pregnancy is a critical period for brain development where even small changes can have lasting effects on a growing baby. During this time, a mother's physical and emotional state plays a very important role in shaping the fetus. Factors such as nutrition, environmental, and especially stress can all influence development when a mother experiences stress. Her body releases hormones like cortisol, which can pass through the placenta and reach the developing brain. This exposure can affect how the brain forms and functions, potentially leading to a longer term effect on behavioral, learning ability, and mental health. Today, I'll be discussing how maternal stress during pregnancy affects the fetal brain development and why it matters. Firstly, maternal stress refers to the emotional or physical strain on a woman may be experiencing during pregnancy. This can come from things such as anxiety, lack of support, financial problems, or health issues. When the body is under stress, it releases hormones, especially cortisol. Cortisol is known as a stress hormone, can pass to the placenta and reach the fetus. While the placenta does offer some protection, high or long-term stress can reduce its effectiveness. This means cortisol can affect how the baby's brain develops. According to O'Donnell and Meany, the exposure can influence brain growth, especially in areas related to emotions or stress. As the brain develops, stress can impact its structure and functions. It may affect areas like the amygdala, which controls emotions, and the hippocampus, which is important for memory and learning. It can also affect how brain cells grow and connect, making the child more sensitive to stress later in life. Because of this, there can be long term effects. Some children may experience anxiety, difficulty managing emotions, or challenges with learning and attention. In some cases, there may also be a higher risk of mental health issues later on. To sum all of this up, maternal stress during pregnancy can have a long lasting effect on a baby's brain development. This shows how important it is to support mothers emotionally and mentally during pregnancy, because it can directly impact the future of the child or the fetus.
Background or biological basis. An overview of pregnancy. Pregnancy typically lasts about 40 weeks and is divided into three trimesters. During this time, the fetus undergoes rapid growth and development, especially in the brain. The fetus is completely dependent on the mother for oxygen, nutrients, and hormones. The placenta plays a crucial role as it acts as both an exchange system and a protective system between the mother and fetus. So basically, this means that anything affecting the mother, including stress, can directly or indirectly influence the fetal development. Stress response and hormonal changes. When a pregnant woman experiences stress, her body activates the hypothalamic pituitary adrenal axis, also known as the HPA axis. This leads to the release of cortisol, which is the main stress hormone. While some increase in cortisol is normal during pregnancy, chronic stress can cause prolonged exposure to high levels placenta and fetal brain development. The placenta connects the mother and the fetus and usually protects the fetus by reducing cortisol exposure through an enzyme called 11-BHSD2. However, chronic stress weakens this protection. As a result of this, excess cortisol can affect fetal brain development, including processes like neurogenesis, which is process of creating new neurons from neural stem cells and progenitor cells, synaptogenesis, junction between two neurons or a neuron and a target or effector cell such as a muscle cell, myel- myelination, which is the process of coating nerve fibers or anons in the brain with a fatty white substance called myelin, which are all essential for a healthy brain function. Causes of stress during pregnancy and how can it affect a newborn? There are several causes of stress during pregnancy. These include emotional factors like anxiety and fear, physical discomfort such as fatigue or pain, social issues like financial problems or lack of support, and health related conditions. These stressors can negatively affect the baby in multiple ways. For example, stress can reduce Blue blood flow to the fetus, leading to low birth weight. It can also increase the risk of premature birth. After birth, babies may show increased irritability, sleep problems, and weaker immune systems. Long term effects may include higher risk of anxiety, attention problem like ADHD, and difficulty regulating emotions. Effects on fetal brain and long term changes. Some effects on the fetal brain and long term changes are high cortisol affects the brain region, which is the hippocampus, the memory part of the brain, the amygdala, which is the emotions part of the brain, the prefrontal cortex, which controls the behavior, and the altered stress response system causes epigenetic changes and may reduce blood flow and nutrients, as I mentioned before. Stress during pregnancy is more than a temporary feeling. It triggers biological changes that directly affect the developing baby, and research show male fetuses are especially vulnerable. In a study of 187 pregnant women, those experiencing high psychological or physical stress were far less likely to give birth to sons compared to healthy women. Male embryos and fetus are simply more sensitive to stress related complications. The impact goes beyond birth. Boys exposed to high stress in utero are at greater risk at neurodevelopment disorders such as autism, ADHD, dyslexia, and early onset psychiatric conditions. Their physical growth, cognitive development, and even long term productive reproductive potential may be compromised. In contrast, female offsprings are more resilient, enduring stress with fewer long term effects.
Main analysis: supporting pregnancy, monitoring fetal health, assisting childbirth, and providing postnatal care. How stress reaches the fetus. The mother's stress releases cortisol, which is the stress hormone, and the placenta normally blocks cortisol using an enzyme 11B HSD2. The chronic stress overwhelms this enzyme, and excess cortisol passes through to the fetus. How stress signal gets programmed. Excess cortisol resets the fetus's stress response, and there are two outcomes: overreactive, which is heightened anxiety, or underreactive, or blunt responses, which is linked to depression. This is called prenatal programming. How neural connectors are affected. Slower communication between brain regions, which causes fear circuit to become overconnected, and the control pathways grow weaker. In summary, 1. The cortisol leaks through the placenta. The stress thermostat is permanently reset. Key brain regions change in size, and the neural connectors become disrupted, and the prenatal stress shapes the fetal brain towards a heightened anxiety and weaker emotional control.
Hi, I'm Maurice Today I'll be talking about maternal stress during pregnancy and how it affects both health development and environmental conditions. Stress during pregnancy is important because it can impact the mother, the developing fetus, and the baby after birth. Maternal stress can affect health at multiple stages. It impacts the mother's physical and mental health, influence the fetus during development, and can also have long-term effect on the baby after birth. Mother's health. First, stress affects the mother's health. High level stress can lead to mental health issues such as anxiety and depression. Physically, physically stress increases hormones like cortisol, which can raise blood pressure and lead to complications during pregnancy. These effects can make pregnancy more difficult and increase the risk of negative outcome. Fetal health. Secondly, stress affects the fetus during development. Stress hormones like cortisol
can cross the placenta and reach the baby. This can influence brain development and the nervous system. It also increases the risk of premature birth and low birth weight. Baby's health after birth. Finally, the effects can continue after birth. Baby exposed to high stress during pregnancy may have more health problems early in life. They may also be more likely to experience emotional and behavioral challenge. In some cases, this can affect learning and attention as they grow older. Environmental implications. This slide looks at how environmental factors can increase stress during pregnancy. These factors can be social, economic, or physical, and they all affect the mother's well-being and the baby's development. Social environment. Starting with social environment, support systems are very important during pregnancy. When someone lacks support system from families or a partner, it can increase stress levels. Relationship problems or conflicts can also create emotional strain. In more serious situations, exposure to violence or unsafe environments can have a major negative implication on both mental and physical health. Economic environment. Next is the economic environment. Financial stress is a big factor because it creates constant worry about basic needs like food, housing, and healthcare. Unemployment or job insecurity can make this even worse. Also, limited access to healthcare and resources means the mother may not receive proper care, increasing risks during pregnancy. Physical environment. Finally, the physical environment also play a role. Living in noisy or crowded areas can increase stress over time. Exposure to pollution or poor living conditions can affect overall health. Unsafe or overcrowded housing can also make pregnancy more difficult and stressful. Overall, these environmental factors show that stress during pregnancy is not just personal, it is also influenced by the condition people live in.
In conclusion, material stress during pregnancy is not just an emotional experience, but also a significant biological factor that can shape fetal development, particularly the brain. Throughout the release of stress hormones, like cortisol, chronic stress can bypass the placenta protective mechanism and directly influence the fetus, altering brain structure, neural connections, and long-term stress responses. These changes can increase the risk of complications such as low birth rate, premature birth, and later cognitive, behavioral, and emotional difficulties. This evidence highlights that the effects of prenatal stress can extend far beyond birth, impacting a child's mental health, learning ability, and overall development. Additionally, environmental, social, and economic factors play a major role in contributing to maternal stress, emphasizing the need for a support and stable environment during pregnancy. So, ultimately, promoting mother well being is essential for healthy pregnancy outcomes. By reducing stress and ensuring social support for